Hi, this is Dr. Walter Salubra of Back to Health Chiropractic Center in Maple, Ontario. Welcome to this video. Today I want to answer the question, how does chiropractic treat or correct for TMJ problems, or how do we assess and treat for TMJ problems in our office? So first of all, let's discuss TMJ. TMJ is an issue or problem with the jaw joints. The person may have pain or clicking, or may notice that the jaw deviates or shifts to one side when they open their jaw. It can be caused from trauma to the head and face, can be caused from trauma to the upper neck joints up here, because these neck joints, the mechanics of the neck joints up here are associated with the jaw mechanics. As well, the nerves of the upper neck here near the brainstem relate to the jaw as well. So if there's a problem here with nerve function, can cause jaw issues as well. But one of the most common reasons for TMJ problems is recent dental work. So you need to ask yourself if you had recent dental work, if you actually are suffering of TMJ syndrome. Why is that relevant? Well, imagine that. You're sitting on a dental chair for an hour, hour and a half. They're doing a procedure on your mouth, and your mouth is wide open, maybe jammed open or blocked open with a blocker. And then you come out of that after an hour and a half and you feel like your mouth is restricted and you can't even move your jaw. So that's one of the mechanisms of injury for TMJ. So if you have pain in the jaw, clicking in the jaw, deviation of the jaw, and some recent trauma, whether it's dental work or other trauma to your neck or face region, then those are some of the reasons how TMJ happened. So how do we assess for TMJ dysfunction? Because we need to assess for the dysfunction of the TMJ joints before I know as a chiropractor if I can correct or adjust for it. So there's a couple of things that I look for. So I have a patient here. I'm going to demonstrate a TMJ exam or TMJ assessment, what I would do in my office if you came in with TMJ problems. So the first thing I do is I look for the motion of the jaw to see if the jaw is opening properly or is it deviating to one side. Let me show you first what normal jaw motion looks like. So I have a patient here, and go ahead and open up your jaw and close. Open slowly and wide again and close, and one more time. And you see it opens and tracks straight down, so she obviously does not have a TMJ problem. Let us demonstrate what a TMJ problem will look like when the jaw deviates to one side, and we'll choose the right side. So go ahead and open your jaw, and you'll see there's a deviation to the right, and close. Go ahead, again, and ahead, and down. So my model here, my patient demonstrated a TMJ problem where the jaw is deviating to the right. Now, that doesn't mean that the TMJ problem is only on the right side. In fact, the TMJ dysfunction is on both the right side of the jaw and on the left side of the jaw, and I'll explain that in a moment. The next thing we're going to ask the patient to do is called the three-finger test. So normally, if your jaw opens normally and wide and everything's functioning well, everything's normal, you should be able to put 3 fingers into your mouth. That's normal motion. So go ahead and do that. So she can do 3-finger test very well. Now demonstrate 3-finger test where you can't put your 3 fingers into your mouth. So if she has trouble opening up the mouth and she can't put 3 fingers into her mouth, then she's failing that test. That's another indication for TMJ. Now, why did I say that both sides of the jaws are related? Well, this is something that's very, very important that an astute therapist or doctor or chiropractor needs to be aware of, because the jaw motion occurs in 2 ways. There's a rotation of the jaw when you open your jaw, and there's also a translation, a sliding. Don't worry about the fancy words, just know that the jaw moves in 2 fashions: rotation and then sliding. So if the jaw deviates to the right side, the rotation component on the right side is normal, but the sliding or translation component is blocked, which means on the opposite side, the translation component is good, but the rotation component is missing. So what that means from a chiropractic perspective, from a correction perspective, that we need to correct both sides of the jaw, both sides of the TMJ joints. Otherwise, you're not going to make an effective correction. I'll demonstrate that in a moment. The other part I'm going to do as a chiropractor, which is very, very important, is to assess the vertebra or the bones of the neck, to assess the spinal functions. What I'm looking for is any shifts on the spine or any blockages in the motion of the spinal bones. That's called a spinal misalignment or a subluxation, especially at the very, very top. So essentially, there's different ways we assess for spinal misalignments or subluxations. This one here is called motion palpation. I also look for tender nodules, do leg length assessments, postural assessments, range of motion assessments. That's all part of the chiropractic exam. But essentially what I'm looking for is any restrictions in the upper neck, the base of the skull. Okay? And if there's a restriction in there, then that will affect the function of the TMJ. So As we treat TMJ, I will certainly do assessments and corrections of the spine first. So I'm going to demonstrate a neck adjustment. The neck adjustment is very, very important for the correction of TMJ problems. And then we'll finish off with an actual TMJ adjustment, and I'll demonstrate that as well. So stay tuned on the next segment. Okay, so we're back. So let me demonstrate the first phase of TMJ correction. You have to have the neck addressed and corrected. Any subluxations or misalignments of the neck need to be addressed before we actually move on to the TMJ correction. So I'm going to start with a correction here, an actual specific chiropractic adjustment, mid part of the neck, the table drops down as an assist, very, very gentle. Turn onto your side, face the other way. Now we're going to address the very top of the spine here, the atlas. An adjustment, and good. Then we're going to move over to start working with the actual TMJ joint specifically. So stay tuned for that segment. So let me demonstrate in this next segment how I actually adjust or correct for the TMJ. We're going to correct two components, both sides of the TMJ. Now, if you remember from the assessment, the jaw deviated to the right side. So we're going to start with a right side TMJ correction. We're going to correct for the lack of translation motion, and then we're going to turn the patient over to the opposite side with their head, and then correct the left side TMJ and correct for the lack of rotation. So let's demonstrate that. So go ahead and turn your head to the left, and support the patient's neck. Table is used as an assist. And we do a very gentle adjustment into the table, just like that. Very, very gentle. Then we're going to do the opposite side. And that's how we correct the TMJ specific adjustment to correct TMJ dysfunction. We need to assess and correct both sides. Then after that, we do an assessment or reassessment of the patient's jaw motion and see what we find. So that's how we go ahead and correct for TMJ problems. If you have any questions about TMJ problems and how chiropractic can help you, and if you'd be a good candidate for chiropractic care, if you have TMJ issues, please give us a call. Back to Health Chiropractic Center in Maple, Ontario. And I hope you found this video useful. Be sure to comment below. I would like to answer any questions you may have. Till I see you on the next video. Thanks for watching.